And then as you move to the right side of the curve where there's great commitment to safety and health, those are our recognition programs like VPP, which you all are obviously part of, our safety and health recognition program. And we spend an awful lot of time with you folks, as you know, in communicating around documentation of your program, doing on-site inspections to document and verify your program, working with you as SGEs as you're working to help certify other folks. So there's a lot of connection between OSHA and those organizations. The distinction on what makes a company have a better commitment to safety, we think, is a safety and health program. And so we are committed overall to increasing the number of businesses that have safety and health programs that we think will shift the curve to the right and help us make sure that we're spending our inspection resources on the people that really need that type of intervention, and that we're doing more compliance assistance, consultation, and recognition for the folks that deserve that sort of interaction with the agency. Now, we are also looking at this from the perspective of there are 10 million workplaces in America. We're not going to be able to inspect our way to safety and health. We're not going to be able to write regulations that cover every issue with safety and health. And so that really relies upon employers being proactive and positive in their safety management. And that's why we think every workplace should have a safety and health program. Now, within the Safe and Sound campaign, our goal is not necessarily to get every workplace into a recognition program like SHARP or VPP. Our goal is to meet people where they are and then to build partnerships with organizations to help get the word out. For the Safe and Sound campaign, if you look at the bottom of the screen, the co-organizers are the American Industrial Hygiene Association, VPPPA, ASSE, the American Society of Safety Engineers, OSHA and NIOSH, the National Safety Council, and the Center to Protect Workers' Rights. All of these organizations have joined together to promote safety and health programs, and we take a management system agnostic approach. This is a big tent. We say every workplace needs a safety and health program that has the three core elements of management leadership, worker participation, and a systematic approach to find and fix hazards. We don't care whose management system you use, whether it's OSHA's recommended practices that I'll talk about more later in this program, the National Safety Council's Journey to Safety Excellence, ANSI, the new ISO standard. Many of our OSHA state plans have state requirements. We don't care whose you use because they all have these three core elements. And again, wherever you are on the safety curve, take a step in the right direction. I'll spend more time on management leadership later, but management leadership really is about getting that commitment from the top. If you don't have the top leaders in an organization supporting safety and health as a core value, you're never going to be able to drive it at the mid-management level or at the frontline worker level. That it's a sincere support for those actions. That it's about developing, communicating safety and health program requirements and policies. That it's about providing the resources, and that it's about recognizing and rewarding the people who are taking the actions. Worker participation is the second core element in that it allows people to tap into the worker collective knowledge and experience. These folks are the ones on the front lines doing the jobs. They know the jobs and tasks that scare them the most. They know where they've had the close calls. They know why people are doing what they're doing, and it helps you really get to the root cause of why safety and health is a challenge in the workplace. The systematic approach to find and fix is about not waiting until somebody's gotten hurt and solving the problem after the fact. It's about a proactive, positive, and systematic approach to find and fix hazards. We will talk a lot more about what this means later on in the program as I get into OSHA's recommended practices. So who's on board with the Safe and Sound campaign? We currently have about 150 partners. If you go to the OSHA.gov/Safe and Sound website, you can see all of the partners. In addition to the co-organizers that I mentioned earlier, we've got the American Red Cross, we've got the American Chemistry Council, the National Association of Home Builders, the U.S. Chamber of Commerce. We've got a number of folks in the construction industry, including the National Association of Home Builders and the National Framers Council. We've got the North American Meat Institute. We've got a number of our education centers. We've got a number of our state plans. So whatever industry you're in, you're probably going to find somebody who is a national organization who's involved and partnering with us and helping get the word out. So those are places you can look for more information. When we talk about the Safe and Sound campaign, it's got 4 core elements. First one is continuous engagement, our communication efforts. National webinars, I'll talk more about that in a little bit. These are educational opportunities. Local events are something that we are building towards, and then Safe and Sound Week. So continuous engagement. We want to be delivering a safety and health program message to businesses on a routine and regular basis. Quick Takes is OSHA's newsletter that comes out 2 times a month, typically on about the 1st and the 15th of the month. You will find safety and health program content in there now in every edition. We are pushing things out through Twitter, LinkedIn, and Facebook. You can find all of that information on those pages, and you'll see some examples down at the bottom. We are doing monthly partner communication updates. So you see an example of that on the right. These are things that we're sending to VPPA or VPPA local chapters. If you're active in a local chapter, you can sign on as a partner for the Safe and Sound campaign, get our partner communication update, and we will give you content that you can deliver to your members on your website, at your meetings, etc. We have a listserv that I would encourage you to sign up for. We've got about 12,000 people on our Safe and Sound listserv, where again, you will get routine monthly communications from us on new resources, webinars are released there, and messaging that you can use. Now, when I talked about webinars, we are doing 1 free webinar every month. So if you're looking for content, if you're looking for learning opportunities, this is a great place to get them. So in February, CPWR, the Center to Protect Workers' Rights, did something on their Foundations of Safety Leadership tool. In March, the American Society of Safety Engineers provided free to everybody a webinar on return on investment from safety and health. This was a pre-recorded webinar. Next week, we will be doing a webinar going over the 3 core elements, so about 15 minutes each on management leadership, worker participation, find and fix hazards. You can find the event on the OSHA webpage or in our communications like Quick Takes. And in May, the National Safety Council will be doing a live webinar on using employee perception surveys to help run your safety and health program. And every month there's going to be new content, free content for folks to look at. Safe and Sound Week is our 1-week stand-down type event that's happening August 13th to 19th this year. This is about raising awareness for your safety and health program. So for folks who have good safety and health programs like you all, this is an opportunity to celebrate what it is you're doing in your workplace and make sure that your workers know and that your managers, mid-managers, and leaders are reminded of your commitment to safety and health. For other organizations who are just getting started, Safe and Sound Week is an opportunity to dip their toe into the pool and kind of try before they buy. So we ask people during Safe and Sound Week to do 3 different activities, 1 in management leadership, 1 in worker participation, 1 in find and fix. We've got examples of activities that range from very simple and easy to do to things that are more advanced and complex depending on the level of maturity of your safety and health program. Management leadership activity could be something as simple as send a message out. It could be at an all-hands meeting. It could be an email. It could be a video post from your senior leaders talking about their commitment to safety and health. Your worker participation piece could be as easy as, at that same all-hands meeting, invite workers to stand up and talk about what they're concerned about, what they're proud about, what they've found most effective, or maybe get your safety and health committee to talk about how they've been involved in managing safety and health. Your find and fix activity could be as easy as reviewing your 300 log or your work comp information with your employees and telling them how people have been hurt in your workplace over the past year and what you've done to address those hazards. We have some other things that are more fun, like PPE fashion shows, or safety and health scavenger hunts, or job swaps, where people can then do inspections at other people's workplaces or workstations in the same work site. So there's lots of fun stuff. We're going to be launching our Safe and Sound Week registration in June, and we encourage all of you to participate at your workplace. Last year, we had people from 49 of the 50 states, every place except Hawaii participated. We had people from Puerto Rico and the Virgin Islands. One of the other things that was very cool is we had participants from 14 different countries. So, you know, a lot of U.S. companies who had overseas operations did it for the entire company, and then, you know, they did them in the overseas operations as well. We had all different types of people participate last year. We had small contractors and construction. We had large construction folks. We had hospitals. We had a zoo. We had a pencil manufacturer. We had Hershey's Chocolate and L'Oreal Cosmetics and UPS in the Northeast region. So all different types of businesses, manufacturing, service, healthcare. We had an Air Force base in Idaho and a Navy base in Italy, and defense contractors in Afghanistan participating. So wherever you are, whatever you're doing, lots of opportunities to participate. We've got some new resources that are under development. We're going to have some suggested 1- and 3-day and full week itineraries for Safe and Sound Week. We'll have some toolbox talks, from some facilitation guides for having dialogues with your workers about safety and health programs. We're going to have some new Spanish translations. And then on the campaign side, we're going to have a list of Ed Center classes. We have some new guidance coming out on better safety conversations. We have some guidance on how to do a walkthrough if you're a manager who doesn't have safety and health responsibilities or is not a safety and health person, as well as for collateral duty safety and health program officers, and some videos. You can find the Safe and Sound website at osha.gov/safe and sound. All right, and now I'm going to transition to our recommended practices. So most of you are familiar with our old guidelines. These were affectionately referred to as the 1989 guidelines on safety and health programs. About a year and a half ago, we updated those guidelines. So we updated them to try and bring them into the 21st century. We've learned a lot about safety and health programs since 1989. There have been changes in the economy, lots more temp and contract workers. We have learned a lot from VPP and SHARP programs. And we've watched the evolution in ANSI and now just recently released the ISO 45001 standards. And so as those standards evolved in the last 25 plus years, we've updated and revised our program. Let me emphasize, these are voluntary standards. They're not enforceable, but they help with compliance. They also are in the process of being rolled through the rest of our program. So, you know, this is changing our thinking as we move forward with VPP and SHARP. We're currently working on updating the SHARP Form 33 guidelines to reflect the changes in our safety and health program guidance. And we emphasize that these are flexible. So again, it doesn't matter if you're trying to do the OSHA program to get to VPP or SHARP, or you're also trying to do ANSI and ISO because you're a larger company and you've got some additional goals. These will work in conjunction with any and all of these programs. So they're very flexible, and it's work at your own pace, adapt to your own workplace. Now, I don't need to preach to you all the benefits of safety and health programs. You all have already drunk the Kool-Aid, but when we talk about this, it's not just about preventing injuries and illnesses. It's not just about improving compliance with your laws and regulations. It's about engaging your workers. It's about increasing productivity. Anytime you have an injury or an illness, very often one of the biggest costs is not the direct cost of the injury. It's not the cost of replacing the workers. It's the cost of shutting down your business or shutting down that production line for the time that it takes to deal with that injury, to do the investigation. If you're a construction company and you have somebody die at your work site and you shut down the job for a day or 2 days or 3 days, those costs can be really, really substantial. So, looking at how safety and health programs affect the total cost for your business, the total productivity, can be really significant savings. Again, you guys have already seen, if you're in VPP, a lot of the benefits, but we've seen the number of work comp claims decrease. We've seen the average cost per claim increase or decrease. We've seen the severity as measured through lost time claims decrease, and we've seen the cost in claims in dollars decrease from implementing safety and health programs. Now, again, when we talk about safety and health programs, we're talking about these 3 core elements of management leadership: worker participation, finding and fixing hazards. All of these things go together as part of the total package. So when we developed our new program, our new recommended practices for safety and health programs, we've now got 7 core elements. Core element number 1, management leadership. Number 2 is the worker participation. Find and fix is elements 3, 4, and 5, hazard identification, hazard prevention and control, and that education and training. What makes it a management system is number 6, that program evaluation and improvement element. That's that continuous virtuous cycle of plan, do, check, act, that you're continuously seeking to get better and better. And then we've added as an entirely separate element now, communication and coordination for host and multi-employer work sites. That this has now become such an important element that this information sharing aspect of running your safety and health program is worthy of calling out as its own core element. So when you look at our guidelines, we've got the 7 core elements. Each of these core elements begins with a brief introduction of what is it and why is it important. These action items each have these core elements each have 3 to 6 action items. They tell you what to do and how to do it. And then we've got some additional appendices. The action items are designed to be very action-oriented. This is different than when you pick up an ANSI standard or an ISO standard and it's written in, in consensus standard speak. These guidelines were designed for small and medium-sized businesses predominantly to be action-oriented and easy to use, but we think that they will also help medium and large-sized businesses. So now let's get down to brass tacks. When we talk about management leadership, you can see the 4 core elements. When we talk about communicating your commitment to safety and health, what does that mean? That you've got a written policy, that you're communicating that policy with your workers, but also with your contractors who work on site, with your suppliers and other vendors. If you're in a multi-tenant building, that you're sharing information with others in your building, that you're talking to visitors and customers so that it's visible within your organization and outside your organization. That is showing real management, commitment, and leadership. When we talk about defining program goals, what we're talking about is that you're establishing realistic, measurable goals, that you're writing them down, and that you develop a plan for how to actually implement those goals, whatever they are. When we talk about allocating resources, what we're talking about there is not just giving money, because you may have to buy more PPE, you may have to bring in outside vendors for particular actions like a training thing or audits. You may have to buy in engineering controls. It's not just that actual money, but that you're also establishing time and allowing time for your workers in their schedules to provide the training or to receive the training, to participate in your safety and health committee, to participate in walk-around inspections, that there's a real commitment for time, and that when you're talking about allocating resources, that you're also integrating your safety and health program into your overall budgeting and planning for the organization. And when we talk about expecting performance from management leadership, that you've identified frontline personnel who will lead your safety and health programs, that you have a safety manager, that you have identified team leads on each shift, that you've provided positive recognition for the folks who are doing safety and health and accomplishing your goals, and that you've established ways for management and all of the workers to communicate about your performance on safety and health in the same way that they talk about performance for productivity or maintenance or any of the other profitability or things that you talk about in your organization. Now, in worker participation, what we're talking about here is really engaging, energizing your workers, that they feel that safety and health is a core value and they feel that you value their input in this. So when we talk about encouraging workers to participate in the program, that you're giving them the time to participate, that you're providing that positive reinforcement, that you're maintaining an open door policy where it's part of the company culture and values that it's okay to talk about these things. When we talk about encouraging your workers to participate, that there's an established process for workers to report injuries, illnesses, close calls, and near misses, to report hazards. That not only are you encouraging them to report back, that you're providing them feedback. You're reporting back to them about what actions were taken, what you found, monitoring reports so that they know that you're listening to their concerns and that they'll be more likely to report their next concern when it happens. Emphasizing that management is only going to use that information to improve safety and health in the workplace, that there's no retaliation for this, and that workers are empowered to initiate emergency shutdowns, temporary suspension of activities, stop work authority is a very powerful way to encourage workers to participate. When we're talking about involving workers in all aspects of the program and giving them access to safety and health information, that you're sharing information that allows them to participate. That could be safety data sheets. It could be sharing your OSHA 300 log or your work comp information in a sanitized way that you're not revealing confidential medical information, but so that workers can begin to understand trends. That you're giving them environmental or occupational exposure monitoring data, that you're sharing incident investigation reports. Involving your workers means that they're involved in developing the program, setting the goals, that they're involved perhaps in participating in hazard analysis, in defining and documenting your safe work practices, writing your standard operating procedures, that they're involved in doing site inspections, that they're involved in doing incident, close call, near miss investigations, that they're involved in helping deliver safety training, that you're empowering people to be part of that safety training effort. Let me emphasize number 5, removing barriers to participation. So these are the negative consequences, are really important, that there is no retaliation, that they are given time and not penalized if they take a few moments to get involved in reporting an incident, and that you don't tag them for decreased productivity, that you're talking to people at an education level, at a skill level, and in a language that they speak. If you've got a lot of people who speak a foreign language, you've got to figure out how to train those people in that language so that they understand what it is you're talking about. Now, hazard identification and assessment, we're moving into the find and fix elements. When we talk about collecting information about the workplace, again, safety data sheets, looking at your machinery and equipment operating manuals, that you've got self-inspection reports, your 300 log, your work comp information, your exposure monitoring results, information from other safety and health programs like your lockout tagout program or confined space or your PPE or respiratory protection programs. Those are all great sources of information about workplace hazards. If you belong to an industry, trade association, professional society, those can also be great places to gather information about your workplace. The next piece of hazard identification and assessment is inspecting your workplace. Regular inspections of equipment, work areas, and facilities. So that could be daily, weekly, monthly, or perhaps quarterly checklists, depending on what it is you're looking at. So making sure that the workplace is clean and free of trip hazards might be a daily activity. Some machines may be inspected on a weekly basis to make sure that machine guards are in place. You might be doing preventive maintenance on a quarterly basis for equipment, but you're figuring out an inspection periodicity. That you're looking not just at your equipment, but at plant vehicles. So if you've got powered industrial trucks like forklifts or carts, or you've got delivery vehicles, that is part of your regular inspection basis. That you develop checklists to highlight things that are related to the hazards like general housekeeping, slips, trips, and falls, electrical hazards, machine guarding, fire protection. Those are all things that are great things that are easy and ripe for checklists. When we talk about health hazards, a lot of people focus on the safety issues and they ignore the health hazards. Safety data sheets are very important for chemical hazards, but also that people are looking at physical hazards like radiation and noise, heat stress, ergonomics, all important things. If you're in a workplace where there's potential for biological hazards, either in healthcare because you're working with infectious diseases, or you're in a workplace where bloodborne pathogens is an important thing because people are getting, first aid type cuts. But also, if you've got mold or other sorts of issues where people are having allergies, that can be a significant concern. Doing inspections in your work, conducting incident investigations is a key piece, figuring out the root causes of why people were hurt. And then after you've done all of that, that you've begun to characterize and prioritize the hazards that are in your workplace. That you've figured out what are the things that are the most frequent, what are the things that are the most serious hazards, and that's something that you're going to feed into your prevention and control plan. So in your prevention and control plan, each hazard is very often going to have multiple options for controls. You can use industry consensus standards, manufacturer literature, engineering reports, OSHA and NIOSH guidance documents and or standards on how to identify the control hazards for various activities. As you're selecting controls, pay attention to the hierarchy of controls. Now, you obviously want to, use PPE as the last line of defense, but sometimes you've also got to consider what are your interim controls. And so sometimes it can be more important to implement an interim control, get people into PPE to address a hazard as you figure out and budget for longer term solutions like engineering controls. As you've done your characterization, that you're updating your hazard control plan to include the list of hazards that you've identified through your routine inspection process. One of the most core pieces where people fall down is not assigning responsibility for who's going to fix hazards. Things need to get on the list and then be assigned to somebody, that you've got targeted completion dates for actually doing all this. That you're implementing your selected controls and that you're implementing things on a worst first basis, getting rid of the worst things that are most likely to seriously hurt or kill somebody, and that you're also picking the easy, low-hanging fruit, that you're going after the easy and inexpensive things. It doesn't take a lot of time to reduce slip, trip, and fall hazards by cleaning up areas and making sure that people are doing that on a routine and regular basis. That you're tracking your action items and making sure that you're moving forward on your plans, that you're tracking the number of things that are controlled and fixed the same day that a hazard is identified, within the same week, within the same month, and that once you get beyond a month, that you're sure that you've got a plan that things that are longer term items really are progressing and that are not just consistently left on the list of things to do. Now, when we talk about education and training within the context of safety and health programs, we are not talking about the regular training that you do for safety and health. This is not respirator training or PPE training or hazard communication training. This is training on your safety and health program, that you are training all of your managers and supervisors and workers, that you are providing training where appropriate to contractors and subcontractors on your safety and health program. What are the policies and procedures in your workplace? What is the function of your safety and health program? How do you report injuries and illnesses? How do you report near misses? Who do you contact when you have questions about safety and health? What are workers' rights under the Occupational Safety and Health Act? When you're training your managers, that they understand their specific roles and responsibilities in the safety and health program, particularly that they should not be discouraging their workers from reporting reporting hazards, from reporting injuries, that they understand as managers what are their techniques for recognizing hazards and methods of controlling. If they have checklists, if you've pushed safety and health responsibilities down to the manager level, what are their responsibilities? How are they going to be measured and assessed? When an incident happens, what are they supposed to do? How are they supposed to begin an incident investigation and report those things? That again, workers are trained on their roles, that if you have people on the safety committee, that they understand as a member of the safety committee, what is their job? What sorts of additional training do they have, perhaps, on hazard recognition? If they're going to participate in incident investigations, have you sent them to an OSHA Ed Center on the incident investigation class and provided them with information so that they can knowledgeably and responsibly participate in your safety and health program? Now, when we move on to the systematic piece of this, what makes it the management system, that you are tracking and measuring performance. There are lots of different ways to track and measure performance. The easiest one are lagging indicators, looking at the total number of injuries and illnesses that you had, the number of exposures, your work comp information. As you move beyond a beginning program, you can start to look at leading indicators. So the number of workers participating in various programs and activities, the percent of the workers who completed their safety and health training, the number of hazards or near misses or first aid cases that were recorded and reported, the amount of time that it took to fix hazards. Is that number going down over time? Are you getting more responsive? Looking at the severity of injuries. These are all sorts of ways that you can look at, are you improving your safety and health program? When you verify that the program is implemented and is operating, this is your program evaluation piece. Are people actually recording and reporting things? How are you tracking key processes? Are the worksite inspections happening? Are the hazard controls happening? When you look back over the last quarter or 6 months or a year, what percent of the items that were identified on your list have been completed? What percent of the injuries that resulted in work comp reports actually had an incident investigation? Did it also show up on your 300 log? So there's various ways that you can look at tracking and making sure that all of the different parts of your safety and health program are working together. That you're doing a program evaluation where you go out proactively to managers and to workers and find out what's worked in the program and what hasn't worked in the program, what could be done better. That you're taking that information when people tell you these are the policies and procedures that are working and these are the things that are not working, that you revise and update for that continuous improvement, that virtuous cycle of what you're trying to fix. Now, the new element that we added on communication and coordination at multi-employer work sites. What we're talking about here is primarily communication. Now, most people will say we stay away from this topic because we don't want to be responsible for our contractors' employees. And we certainly understand that. But there are ways that you can improve coordination and communication without buying ownership of your contractors' employees. It starts with making safety and health part of your contracting procedures, your procurement procedures, your bid selection procedures, that you're asking for safety and health information, that you are demanding that they provide information and participate in safety and health conferences. That can be with your staffing agencies or with contractors, that you're sharing information about the hazards and policies and procedures and expectations in your workplace, that you're asking your business partners to share their information around management leadership, worker participation. How are they going to find and fix? How are they training their employees? How are they communicating and evaluating their program? That these policies for effective coordination are written into your bid contracts and that you enforce them as you're doing this. That you've got a mechanism for identifying issues that may arise from on-site work. There are times that you're going to be creating hazards that may expose your contractors' employees. There are times that your contractors and other multi-employer worksite folks may be creating hazards in the course of doing the work that they're going to be doing. You want to make sure that they're telling you that they're doing hot work at your work site, or that they're doing something that's going to release a chemical that may require people doing things in your workplace, or your employees doing things, that they're creating noise that might be elevated for a while beyond a level that's safe, and that you need to provide temporary hearing protection or move people to another location, so that you're sharing that information in a proactive, positive way. Now, in addition to this information, we've also got a number of tools and resources. We have a number of case studies on safety and health programs. We have additional resources covering every area of the core elements: how to do incident investigations, how to use your OSHA 300 log. We've got lots and lots of information on the OSHA website. We've got a crosswalk showing the new recommended practices, or relatively new, compared to the 89 guidelines, the VPP requirements, National Safety Council's Journey to Safety Excellence, OSAS, and the ANSI Z10. We're in the process of updating this crosswalk to remove OSAS because that's being replaced by the new ISO standard. But you'll see how the core elements map to all the different standards. And all of them have the same things. They call them different names, deal with them in different ways. We also have a crosswalk to existing OSHA standards, like this one, this shows this. So the OSHA standards don't require a safety and health program, but there are elements of a safety and health program that are built into lots of different OSHA standards. And so what we've done is go through all of the OSHA standards and show how various provisions map to the different core elements of our recommended practices. So the things that you're doing for your compliance will help your safety and health program, and doing your safety and health program will help with your compliance. We have some other things that are in development right now. We're working on guidance on using leading indicators to encourage more people to do things before workers are hurt. We are working on a new guidance document on the role and value of OSH professionals in safety and health programs. What we found, particularly for small and medium-sized employers who don't have the resources to hire somebody who's a certified safety professional or a certified industrial hygienist or have a full-time safety manager, what we're talking about here is very similar to bookkeepers. A small business may have a bookkeeper who does day-to-day bookkeeping, but when it's time to file quarterly taxes or end-of-the-year taxes, they go to the certified public accountant. Similarly, they may have collateral duty safety officers who handle safety on a day-to-day basis, but there are times when you have a significant incident where you may want to bring in some type of OSH professional, or you add a new pieces of equipment or a new process, and you may want to bring a certified industrial hygienist or a certified safety professional to do some monitoring or help make sure that the machinery is installed safely, or develop new standard operating procedures, or conduct new training. There may be a time during your annual program review where you want to bring in an OC doc or an OC nurse to help analyze your 300 log and your work comp information to look for trends and opportunities for improvement. So we're trying to identify times and situations when people would benefit from bringing in outside professionals to help. We have a new tool on Safety Pays. This is showing the benefits of safety and health programs and reducing your injury rates and helping people understand how it improves their business. And we're starting to venture into the world of safety conversations and safety culture, and we have a new guidance document that will be coming out soon promoting better safety conversations and looking at safety culture as the why people do what they do, and your safety and health program as the what people should be doing, and that it's the why and the what together that help shift that safety curve. And with that, let me point you to our website for the Safety and Health Program Guidance. It's OSHA.gov/SHP guidelines. You'll find lots of information and all of these additional resources that are out there. And now let's open it up to questions. Let me switch windows. And our moderator, if you could help me, I am not seeing my window for questions.
I unmuted everybody, so if anybody has any questions, they're more than welcome to ask right now. I didn't get anything in the chat box, but you can either type it in, your question into the chat box, or go ahead and say it out loud. Okay, I have a question from David. It says, ergonomics is generally shown to be the #1 type of injury/illness and the #1 in workers' compensation. What is OSHA doing to support management on this critical issue?
Sure. We've got lots of information on Ergo on our website. This is also a very sensitive topic because we started working on a regulation on ergonomics, and that was killed by the Congressional Review Act. So the agency is generally prohibited from working on regulatory issues on ergonomics. We have done a lot of work, particularly in healthcare, on safe patient handling, lifting, and repositioning, because ergo is a huge, huge issue there. And within the construction industry, we've done some work on material handling. But if there are particular topics on ergonomics or particular industries, we'd certainly love to hear about suggestions where there's opportunities for us to do better work.
Okay, I have another question. Can federal employees from another agency be SGEs?
Yes, I believe that federal employees from another agency can be SGEs. That's my understanding. And we are happy to have folks you know, come out and help with re-inspections and certifications anytime.
Okay, do we have any more questions? Going once, going twice. You're more than welcome to speak up too. No questions?
Okay.
I think that's it, yeah.
Well,
Okay.
thank you everybody for your
ahead.
time today. I hope you found this useful, and I encourage you to go to the OSHA website, sign up for our Quick Takes newsletter, and look at some of our resources.
All right. Thank you, Andy, and thank you for volunteering your time to educate everyone. And thank you to our members for your guys' continued support. As a reminder, registration is now open for the 2018 Safety Plus National Symposium in Nashville, Tennessee. So make sure to register on our website. And thank you. Have a good day.
What do you guys think that stuff like this is